A large component of training when we're looking at our overall performance picture and how each day within our training cycle, each month, each week, each session accumulates on our body. As athletes, we all know how crucial it is for us to take our recovery seriously. To make better decisions for our training in the future, recovery is crucial to that whole picture. If we're not recovering properly, that's going to affect us in the long run. And this week, our 5-Minute Friday is going to take a look at whether cold or heat therapy is better for you post-training and for increased benefits. Hi, I'm Dr. J, and welcome to 5-Minute Friday. I have a background of a master's in human performance/applied sports science and a doctorate in sport and performance psychology. This week's episode of 5-Minute Friday is going to cover whether or not cold or heat therapy is better for you following training sessions. So when we think about training and the soreness that can follow after we do strenuous exercise, or we overreach a little bit, or we challenge our system to go beyond what our normal capacities are, we're going to experience DOMS. And DOMS is short for delayed onset muscle soreness. And typically this will peak 2 days after we have a training session, and it can be cumulative as well. And so if we're starting training camp or we're having a series of 2-a-days, we can experience DOMS even if we are in a conditioned state of sorts. But in order for us to move to that next level, it might take a little bit more work and a little bit more effort. And because of that, our muscles have to go through change, and that adaptation does cause some muscle damage and temporary weakness in that muscle as it is working to heal itself, and our metabolism is clearing out the lactate, is clearing out any of the damaged muscle cells, so that it can be repaired, regenerated, and added more fibers so that our body is able to handle those bigger stressors. Our body is able to do more endurance work, and our body is handle more force output, whether that is strength related, power related, or even speed related as we're moving through our sport. When we time this muscle soreness and these changes in our training capacity or challenging our system with the changes in our training sessions and in our training programs, this leads to long-term gain and long-term benefit. And when planned properly, we're able to bounce back from these sessions. But ultimately, when we look at recovery is going to shorten the amount of time that it takes for us to be ready or at our pre-baseline value to be able to get back to activity with intensity, with that hard work, and with those new adaptations that are going to lead to us having clear performance enhancement. And this could take weeks, this could take months, but it's going to be part of our everyday picture, or at least following every physical training session, so that we can be ready for our next physical activity or our next performance. So then in creating a baseline concept of what cold therapy is, this could be cold tubs, this could be ice packs, this could be ice massage, this could even be cryo chambers, and this could be like the game readies as well, where we're having ice exposed to our body in different capacities, right? The whole purpose of cold therapy is to reduce swelling, is to reduce the metabolism of that area, so that the swelling, also known as an edema, will go down and our body isn't sending as much blood or as much fluid there, so that we can reduce the swelling impact. And additionally, it can also help to reduce pain. So then on the flip side of that, heat therapy typically looks like diathermy, which could be heat used through an electrical current. Also, this could be hot packs. This could be heat packs, ultrasound, and even hot hydrotherapy or warm hydrotherapy, where we're looking to warm our body up with our muscles as well. The whole point of heat therapy is the exact opposite of cold therapy, where we're looking to increase the blood flow, which can increase the healing capacity of our body, which means that it's going to take less time for our body to heal those damages, right? And it can also reduce pain. But the impact of heat is also dependent on the ability for it to penetrate past our superficial layers and get deep within that muscle that we're looking to affect. So then the study that we're going to pull our information from today had 100 subjects, and it was a mix between women and men. And within that, they had 5 different groupings. So they had the control group, where they only went through the squat exercise, which was 15 minutes of squatting continuously, which was pretty challenging. And then our second group was a group that used heat immediately after exercise, and the heat was applied for 8 hours as a hot pack, and then ice applied immediately, which was applied for 20 minutes right after that exercise. And then our other 2 groups were that same heat pack applied for 8 hours, 24 hours after exercise. And then that same cold pack applied for 20 minutes, 24 hours after exercise. As we're looking at being able to maintain our strength even through soreness or even after strenuous exercise, the control group had a 24% decrease in their strength 1 day after this strenuous exercise. Whereas our group that used heat immediately, or our group that used cold immediately, they only had a 4.5% decrease. But then our groups that used cold and heat 24 hours after that, they had a similar effect as the control group, where they had that 24% decrease in strength on day 1. So the heat immediate group regained their initial baseline strength value by day 2, whereas the cold immediate group, they didn't regain their baseline strength until after day 3. The group that did cold therapy 24 hours after the activity recovered slightly faster than the group that did heat 24 hours after that exercise session. Heat 24 hours after session was still better than the control group. So either therapy, whether that was immediately after or 24 hours after, was still better than the group that did not do anything following exercise for gaining their strength back. So when we mentioned DOMS, we mentioned soreness, right? And that soreness can be accompanied with pain. And following the test, all of our groups experienced pain on day 1 after exercise. And those that continued to experience pain, the pain peaked at day 2 following our exercise, which is right in line with the expectation that we have, where DOMS can last and start affecting us anywhere from 24 to 48 hours after exercise. And depending on your training status before that strenuous exercise, it may last a little bit longer. The least amount of pain that was felt by any of our 5 groups was our cold immediate and our heat immediate. Okay, so if you're looking to reduce the impact of your hard exercise or having a peak day within your training cycle, your best bet, heat or cold therapy as you choose, but immediately following your exercise. And then there was no difference in the amount of pain that was felt between our cold 24 hours later or our heat 24 hours later therapy groups. But then on day 2, cold therapy 24 hours after exercise group felt less pain than our heat after 24 hours group. So the biggest takeaways from this study, all 4 groups were effective. So our cold immediately, our heat after 24 hours, and our cold after 24 hours were all more effective than our control group, where they did nothing following that exercise. And all 4 of those test groups were able to reduce muscle damage and to reduce pain that was experienced as they were sore from this exercise. If we're looking at immediate strategies, which is better between the heat or the cold, heat immediately following exercise was better at reducing strength loss the following day. So if you need to be ready to go again the next day after having a tough training bout, maybe your better bet is heat therapy if you can. All right. But then looking at our groups that weren't able to use the therapy until 24 hours after session, if you're much later than that immediate effect, maybe your better bet is going to be to use cold therapy. And that cold therapy is going to be great at reducing the amount of pain that is felt from that soreness that you're experiencing. If you're not able to use cold or heat immediately, using cold might be a better bet, because they found out that the cold therapy after 24 hours, was much better at preserving muscle strength and reducing tissue damage than heat was 24 hours after exercise. So then as we look at the big picture of everything, we are best off trying to utilize therapies immediately following our hard training sessions if possible. And then even if we have to wait a day after, we are still good to use either heat or cold as we tolerate, but that cold might be better at the 24-hour mark, and the heat may be better at that immediate point right after exercise. Ultimately, a lot of this picture will come down to, what do you have the most access to? What are you most comfortable using? And what feels best for your body? Some athletes are going to respond better to the heat. Some athletes are going to respond better to the cold, no different than people being able to handle different temperatures accordingly. But it all depends on what our aim is, right? And so if we're looking for that range of motion, if we're looking to be able to have a lot of our strength available to us on that following day, heat is going to be our best friend. And if we're looking to reduce swelling, potential inflammation, and things of that nature, cold is going to be our friend, and cold will also help us reduce pain. Heat will, but it all depends on when we're able to use it. And so if we're using something immediately after session, that's going to give us a different kind of benefit than if we use something 24 hours later. But the awesome part is, whether you're able to do this immediately or you're able to do it 24 hours later, both of those situations are still going to be better than if you do nothing at all. And so ultimately, this is my encouragement for you to take your recovery just as serious as you take your training, right? And for us to have this ability to do these things, we want to be able to repeat these high level things in any capacity so that we're able to use them to the best of our ability in our sport. Our main message is continue to take care of your body just as much as you continue to challenge your body, right? And rest can be important, but we also need to challenge the system to have this growth and have this adaptation. For more specific help on any of the things that you're looking to utilize to benefit your training and to get that performance enhancement edge, please reach out. Join us again in 2 weeks as we cover our next theme. And once again, I'm Dr. J, and as always, be refined by the grind.